Hi, this is Chrissy with Guidepost to Wellness, and I just read a medical study that I really wanted to make sure that I shared with everybody because I basically have discovered one thing that all of us can do right now to protect ourselves from any wintertime viruses. I'm not going to call out any specific viruses at this point, but there's one thing that we can all do to help protect our immune system. So welcome back to anybody that is been coming to the channel for a while, and welcome to anybody that's new. This channel is designed to talk about topics that have to do with wellness, all types of wellness, and that's why today I wanted to talk about getting your vitamin D levels tested. Now, I just did a video a short while ago about vitamin D, and the reason why is because with the change in seasons, it's really common for people to get less vitamin D. About 80% of the American population is low in levels of vitamin D, and that really is dependent on where you live in relation to the equator. So the angle of the sun, because most of us get our vitamin D or get the best forms of vitamin D through our skin. And I'll put a link down for that other video, but I talked about things like age, sunscreen usage, how dark your skin is. All of those factors can determine how well you can make vitamin D through your skin. And this study that I was just reading about re-emphasized the importance of vitamin D in your immune health. So vitamin D is critical, and most of us know that it's important for strong bones and teeth, but it's really important for our immune system and the parts of our immune system that combat viruses and for tumor growth, hormones, blood sugar, mental health, even cardiovascular health. And so talking about the changing seasons and the effect of not having as much sunlight and how that can affect your neurochemicals and your mental health, vitamin D levels in your mental health. So all of those are important factors. But when we talk about vitamin D in your immune system, I think this one is critical. This is an unprecedented time of, well, it's been an unprecedented year for many reasons, but with a virus that's going around, and one especially that affects the lungs, and other viruses that are always around like colds and flus and things, it's not surprising to find out that vitamin D, which is important for your immune system, and then the times of year that people get these illnesses more often are times that correspond with low vitamin D, high viruses. So I think that that's all really important. Now, you may not see a lot of this in the mainstream media, but regardless, the studies are there. I'm going to put some information down below. There can be talk about vitamin D can be toxic and things, and I've got information about case histories about how you really have to be taking an extraordinarily high amount of vitamin D3 a day before you ever would get any type of toxicity. And like I mentioned, the most important thing that you can do is get a vitamin D test, which means that you're going and you're talking to your doctor, and your doctor is going to ensure that you're not taking too much. Don't self-diagnose, don't self-treat. Make sure that if you have never had your vitamin D tested, or if you don't know what your level is, then go get it tested. It's a very inexpensive, quick test, and it is something that your doctor can either recommend how much of an over-the-counter to take or prescribe you a dosage. So, but one of the things that they found recently with the virus that's been going around this year in 2020 is that when they plotted the mortality per million rate against latitude, it can see that all countries that lie below 35 degrees north have lower levels of mortality. And if you look at that level, that corresponds with the level where people really start to suffer from insufficient sunlight to get vitamin D levels, and especially during the winter. So that's why they're thinking that there's a possible role for vitamin D in helping improve your immune system and the outcomes from the virus that's going around this year and any other virus like the flu and things of that nature. They're also actually doing studies that show that vitamin D is really important in suppressing inflammatory cytokines in the respiratory cells. And that's huge. Because that's where the virus this year has been hitting. That's where the influenza and pneumonia viruses can hit as well. So again, they're actually doing studies of vitamin D with the virus, the novel virus from this year, and treating people in the hospital with vitamin D levels to see if that helps. And so far it's encouraging. As with any study, it has to be repeatable. There's a lot of factors before you can take a study for gospel. But we do know, and there are plenty of medical studies that show that vitamin D is important for your overall health, which is always important to boost in the wintertime, and also for the health of your overall immune system. So the one thing that we all can do is get your vitamin D levels tested. You should be between 30 and 60 nanograms per milliliter. On your test results, like if you go online and maybe pull up some old test results or anything like that. But you need to realize that based on the fact that we are in the northern hemisphere, fall and winter and stuff like that, so I would get your levels tested now. If you had your levels tested during the summer or something, they may not be as accurate. Or if your doctor has told you in the past to supplement, those are good things to do. So get tested. If your doctor recommends supplementing, then do that. So your doctor can provide you the information based on your health, your weight, and then they can also provide information on what type of vitamin D. Do you need any of the cofactors? Every vitamin in our body does not work in a vacuum. They work with other cofactors, and vitamin D works with things like magnesium, calcium, vitamin K2, and vitamin C. All of those are needed in order for vitamin D to help with bones and teeth and skin and things like that. So the other factors are obviously where you're living, how much melanin you have in your skin. Another thing that's really important is vitamin D is made by, or I would say at least absorbed in the gut. So gut health is really important. So that's one thing that you're going to want to talk to your doctor about as well, because that may determine whether or not you're absorbing it as well as possible. So if you do get the novel virus, or you do get the flu, and if you are thinking about taking it over the counter, then you might want to talk to your doctor, call them up real quick and ask them if it would be okay to up your doses. Again, I'm not a doctor. I'm not going to make any recommendations. But I am going to put some studies below that you can read a little bit more about. And one of the things that I will tell you about vitamin D absorption is the fact that it is a fat-soluble vitamin, so it is really important to make sure that you take vitamin D with a high-fat meal. Time that however you want during the day, because believe it or not, vitamin D can help with sleep if you take it at night. It can help with mental cognition and clarity if you take it in the morning. Most people typically eat their largest, fattiest meal at the end of the day, but make sure that you are taking a vitamin D supplement if you're taking one with a meal that has some fat with it. Otherwise, there's some really good foods that you could take. I'm going to put a link to more foods. But amazingly, cod liver oil, 1 tablespoon of that a day, and cod liver oil is already a fat, will give you 170% of your daily IUs. So that could be something. I know some older people in different generations have used cod liver oil in as part of a home remedy. I just had trout the other day. It wasn't farmed, so it probably had even better nutritional profile. But just 3 ounces of rainbow trout can provide 81%. So eating fatty fishes, salmon. I had salmon for lunch. I think it was a 2.5 ounce pack of salmon. So 3 ounces is 71%. So right there in one meal, I got a lot of other healthy things, but I got probably more than 50% of my daily allowance of vitamin D. So if at all possible, talk to your doctor, get your vitamin D tested. Talk to them about supplementation. If you know that you have low levels and you have had guidance from your doctor before, that's great. Please don't go over the recommended amount. More is not better when it comes to everything. You want to make sure that you're taking a daily recommended allowance. Get tested. If you do get the novel virus or any other types of viruses, especially something respiratory, then you might want to bump up a little bit and make sure you're taking it with fat. So hopefully you find that helpful, that there is something that you definitely have within your power to do to help you have a better virus season this winter. Take care, thanks, and be well.